Hey everybody, Dr. Oliver here for backintelligence.com, and today we're going to talk about back pain in its relation to pregnancy and some strategies you can use if you're dealing with this. If you haven't done so yet, click the subscribe button to get access to videos as we put them out. I often treat pregnant women because of back pain. There's a lot of changes that occur, obviously, and one of the big ones is the size, right? As a woman progresses along in pregnancy, she gets bigger. Because of that abdominal change, your center of gravity is actually going to start to change, and you'll increase curvatures in your lower back. You'll put a lot of more pressure in your lower back. You'll change different positions. Your pelvis starts to change as well as getting ready to deliver a baby. So we tend to see a lot of stress in people's backs. So just straight up back pain is common. Sciatica tends to be common, which is pain that travels down the leg. So generalized back discomfort is extremely common in pregnancy, and these are a few strategies that we've determined are really good at getting patients moving better and just feeling better. So we're going to go over a few strategies. I don't have a pregnant patient with me, but I got Leon, and he's going to step in for that role. So we're going to start out with the most basic one stretch that we like for pregnant patients and not pregnant patients, but we're going to go into that cat-cow position. So to do that cat-cow position, we're going to get on the ground, right? We're going to get on the all-fours position, hands under the shoulders, knees under hips, and we're going to initiate that motion from our pelvis, right? We're going to do those pelvic tilts up and down. We're going to work on range of motion through our spine from top to bottom, and we're just going to move. Again, this should be comfortable and pain-free. You're going to oscillate back and forth, trying to stretch some of the structures in your low back in either direction. This, again, should be pain-free. And you'll notice as you progress along in pregnancy, it's going to be more difficult to actually be moving there. So don't push anything that hurts. Just get some movement. All we're trying to do is give your body some nice, safe, gentle movements. We generally will do 15 to 20 of these at a time, and we just move to what feels comfortable. The next stretch and exercise we're going to do is we're going to go on our back, and we're going to get our hips moving. Hips tend to get pretty sore and tight on pregnant women because of everything that's changing in the pelvis. So we want to just work on gentle ways to mobilize the hips without causing undue stress. So we're going to have Leon, he's going to lay on his back. So he's going to have his feet, and he's going to get them a little bit wider than his knees. Yep, keeping them flat on the ground. And then all he's going to do is simply roll one knee in while the other one gets out of the way, and then switch to the other side. Again, we're not pushing into pain. We're just moving to what feels good. We're going to feel a lot of that stretch go along on the sides of the hips there. This should feel good. It shouldn't hurt. If you can't do the range of motion that Leon's doing, you don't do it. You do what feels comfortable. We're going to do 10 on each leg. So you can do up to 20 of these at a time, back and forth, just to try to open those hips up a little bit. And again, no pain with this. Just listen to your body and move with what feels good. All right, the third strategy we're going to use to help with this back and pelvic discomfort during pregnancy is a side-lying pelvic release. Now, this is going to require some assistance. You can't do this one on your own, and you're going to need someone. So grab a partner, grab a friend, grab someone that can be there to assist. They don't really have to do much, but they're going to just be there to hold and stabilize your hips and pelvis a little bit. So you need a bench. You can do this on your couch as long as it's not too soft, or a bed as well. So we're going to have Leon actually lay on this bench right here. He's going to lay with his hip up. So we're going to show you from both sides. We'll show you from this angle first. So ideally at home, you would have a little bit more room here, but all we're going to do is we're going to have you stacked up. You want your shoulders and your hips in line, so you're lying straight on your side. You're not twisted or rotated here. The partner or the assistant is going to place their hand gently on your pelvis, right on the side here. If you find there's a little bump on the front of your hip right here, it's called your ASIS, we're going to just have our palm resting there. We're not pushing down hard. We're really not doing anything. All we're going to do is prevent Leon from rolling off the table or bed or whatever you're doing. But that really shouldn't take much pressure at all. Then what we're going to do, with the bottom leg bent, you can take this top leg and straighten it out. So the assistant's going to grab the leg and gently going to start to pull it forward. Again, nothing that hurts. We're going to make sure that this bottom leg is kind of out of the way, because what we're going to do is actually let this leg drop down. So I'm going to slowly lower this leg down as far as I can. What we're looking to do is let this leg hang. Now this is where my pressure comes in. Again, not a lot. I'm just making sure that he doesn't roll off the table. We're going to let that leg hang. We're going to use gravity as our friend, and he's going to feel some pulling and some stretching along his pelvis into here, maybe into his back a little bit. This should not cause undue stress or pain. If it does, reduce the pressure or reduce the angle a little bit so it's not pulling as hard. If it does hurt, you can't do this exercise, again, it's not a good strategy for you. We're going to hang out in this position for a full minute to start out with, make sure it feels comfortable, and then we do the other side. We always do both sides. This is something you can do once a day for right now, again, as long as it doesn't hurt. So we'll show you from the other side. So we're going to have Leon get up and flip around to the other side. So again, we're going to just get him in a nice position here. This bottom leg, we're going to kind of pull out of the way a little bit. This top leg, I'm going to come around. I'll try to not obscure the video here, but I'm going to be right here, okay? We're going to take this top leg, we're going to hold it, we're going to pull it forward, and we're going to start to let it hang down, okay? You can tell that his foot is not touching the ground. It's important at home, whatever you're laying on, you're not just touching the ground, because then you're not getting that pull effect. Again, I'm stabilizing right here at the side of his hip, not pushing hard, just holding, and we're going to sit there for a minute. Should not cause pain. You may notice one side feels better than another or looser than the other. That's fine. You do both sides the same amount of time. We're doing a minute, and we're just going to let this hang. And then you return that leg back to the start position, and then you can help them get back up. So try these few different strategies we have. Again, zero pain should occur with any of them to see how it does with reducing your back pain and tension.
I hope you enjoyed this video, and if you did, please like it and share it with a friend. Also, we'd love to send you 3 posture correction exercises that we've done with Dr. David Oliver. These videos will help correct that forward head and rounded shoulder type of posture that we're all suffering from today. So if you'd like to get those 3 videos, there's going to be a link to get them somewhere here on the video or down below in the description. Go to that page, enter your email, and we'll send you those videos right away.